everyone. This is Dr. Mark Riggs with 5280 Functional Medicine, and you're listening to part 2 on how to prevent and treat type 2 diabetes with natural medicine. So, next, we're going to talk about risk factors for type 2 diabetes, specifically modifiable risk factors. And the number one risk factor for developing type 2 diabetes is obesity, which is defined as body fat percentage of greater than 25% in men and greater than 32% in women. It's no secret the United States is currently suffering from a metabolic epidemic where obesity is a major problem contributing to many diseases. And it's currently thought that obesity will soon overtake smoking as the number one cause of preventable death in America. In 1980, 14% of adults in the United States were obese. Fast forward to 2014, where 34%, or 1/3 of adults in the United States were obese, and another third is overweight. And again, in 1980, there were 0 documented cases of childhood type 2 diabetes. And then we fast forward to 2014, and there are 56,000 kids in the United States with adult onset diabetes. One thing that I like to ask my patients is, do they think that weight control is simply a matter of calories in versus calories out? Because we see this on the news often in here in the United States, that we need to just move more and eat less, and then we'd all be better off, and nobody'd be obese. And I also like to ask, are all calories the same? And tell me why you think that, or why not. And the reason why I like to talk about that is because this move more, eat less philosophy is really deceiving. They make us think that all we need to do is just move more and eat less, and that'll fix all our problems. But the answer is that all calories are not equal, and most of us realize that, but I guess maybe we make excuses for it. So weight control is simply not a matter of calories in versus calories out, and the move more, eat less philosophy is absolutely incomplete. And the missing link is what I have here down below. The move more, eat less philosophy that quote unquote experts like to discuss on TV every few months regarding the obesity epidemic in the United States focuses purely on portion sizes, or the quantity of calories that we take in, and then exercise and body movement, or the quantity of calories that we expend, but they refuse to address inherently disease-causing foods. In other words, the quality of the calories that we're consuming. And that's something that, execs of McDonald's and Coca-Cola and others really don't want to include in their discussion, because it would go against what their company is selling and hurt the bottom line, right? So additional modifiable risk factors beyond obesity, which is the number one risk factor, include our diet, specifically how much garbage we're taking in from the Western standard American diet, including refined sugar and flour, trans fats, hydrogenated oils, smoked, cured, and processed red meats, fried foods, and even dairy products. And at the same time, consuming inadequate amounts of colorful fruits and vegetables, wild-caught fish and poultry, healthy oils, nuts, seeds, fiber, phytochemicals, antioxidants, vitamin D3, and EPA and DHA. Other risk factors include a sedentary lifestyle, poor quality and quantity of sleep, and of course, stress. I don't like to include an overabundance of clinical literature in my talks because I'm afraid of putting people to sleep, but I liked this one in particular. It demonstrated a link between diabetes and the standard American diet. This was a Physician health study conducted by Harvard researchers of 42,000 physicians. They divided into two groups. One ate the very healthy diet, one ate the standard American diet, and the subgroup of people that consumed the Western diet alone were at a 50% increased risk of type 2 diabetes. Participants that ate the standard American diet and had low physical activity levels had a 100% increased risk for developing type 2 diabetes, or 2 times the risk. And astoundingly, if any of the people in that category of consuming the Western diet, the standard American diet, happened to be obese, their risk for developing type 2 diabetes jumped to 1,100%, or 10 times the risk, making obesity the number one risk factor for developing type 2 diabetes. Coming up next in part 3 of how to prevent and treat type 2 diabetes with natural medicine, we will be discussing how to test for type 2 diabetes. Thanks for listening.